All right, good morning, everybody, and all the participants who are here. And as I said, we're going to talk about the COVID pandemic. And once the COVID is over, so how are we going to plan the academic for the high school students? This is Shakti, and I'm the regional manager at Texila American University. So right now I'm going to introduce about our speaker, Dr. Dev Sharma. And he's a doctor by profession, and he's been registered as a medical doctor in various Caribbean countries like St. Lucia, Grenada, Guyana, and more. And he was also a chairperson working in different Caribbean medical school, preferably, Ross Medical School. And he was also a chairperson in terms of the decision maker in Ross Medical School. And he's also a psychiatrist, and right now he's working as a psychiatric in the hospitals in Guyana. He's worked as a consultant in the Georgetown Public Hospital and a couple of other private hospitals called Woodlands and St. Joseph Mercy as well. Yes, Doctor, over to you. And so the participants are more likely awaiting to hear from you.
Thank you, Shakti, and very good to be with our group here in Guyana. We were last week talking to a group in the Caribbean and had some very good interactions with persons from Jamaica, Trinidad, Grenada. So I hope my colleagues, and I'm glad that we have the opportunity to discuss this very important issue. Just a correction, I'm now with the Public Hospital of Guyana. I'm actually with the Woodlands Hospital and the St. Joseph Hospital in Guyana, which are private institution. As you know, I'm also a professor at Texila, so I'm very, very happy to be with you all, and I really appreciate what you're doing to bring important issues related to the COVID virus to the awareness of our people, our very important people, the leaders in education, and many of you out there connecting to this webinar are leaders. So we need to discuss. I'm not here to direct, but to be part of a discussion that looks at a future that's possible for education for our high school children. And this webinar is more tailored to high school children. I'm hoping we have Dr. Burnett joining us, and because she's a pediatrician trained like myself from the University of West Indies in Jamaica, and she's also been a professor at Ross Medical School, now in St. George's, Grenada, and very experienced in terms of child development and adolescent development. So, all right, so we are good to go. And I want to thank again everybody for their patience with the internet problem. So we're seeing one of the logistical problems that's going to be there if we move to primarily online school teaching, which I personally think it's going to be difficult. There are a number of issues with it, but it's possible that may be the way the future goes. So let's go to the objectives of this presentation. And we're looking at how the COVID virus has affected us in this world of ours in the 2020 year of existence, après Domini. And we're going to look at some of the strategies that I have and researched and also discussed with a number of persons in education that might be valuable as we move forward to the post-COVID era, whenever that comes. And there is a slide that one of our doctors shared the other day that is hopeful that, they were talking about maybe this will go on for another year. And it's possible, but there's more likelihood that countries will start to reopen within several months, and some countries are already opening up their workforce. Schools, though, may not open until the next term for most schools, which start in September. So we're also going to look at how we can plan for that future if we keep the same model or not. So we've seen in this time those futuristic movies, and this one, for those of you who saw Contagion, will remember was about in 2011, where they actually simulated exactly what's happening now, almost, Matching what's happening now to that time, nearly 10 years ago, a decade ago, where Contagion had the MEV1 virus, and it caused a pandemic, Where in that situation, the difference, thankfully, was that it was killing about 30% of people infected. Our mortality rate here is about 3 to 5%, and we are more vulnerable by persons who are older and persons with pre-existing conditions. So a little bit of positive difference for us. So it was a pretty scary situation. And this is also from a reflection on the movie. And why I'm bringing this is that, could people have known about this situation? Or there predictors that we didn't follow? So I think we gotta keep an open mind to what we hear, what we can learn from the past, and whether we believe that there was some planned event for us. We clearly are seeing events unfold in a parallel way to what this movie was describing. We don't want to see this situation where there will be riots and looting. So as we plan for the future, we got to look realistically about economy and workforce. It's not only about safety of our health, but it's safety of our finances. Finances are very critical. How are we going to afford to do the things for our children if we don't have the money? And we don't want the situation to go out of control. So it's got to be sensible planning. And just a little bit of this background before we move into the real topic itself as to how we will plan strategically for the future. And I don't want to be talking all the time, so I want to really have some time to interact with our audience and have a little bit of discussion and feedback, so that maybe we will all be able to be more capable to guide our leadership, our ministers and directors of education. Again, in terms of the outbreak, as you know, there is something that we learned, that the virus seems to be coming from the animal population. So there is this cross spread and possibility of viruses jumping from species to species, in a number of cases from the animal, the bats, wild animals, and the Ebola virus, as you remember. Now here's a bit of history, and if you look at this in terms of numbers, we are seeing a terrifying number of figures where people are losing lives, and this is unfortunate. But if we reflect on the history of mankind, if we go back all the way to the plague of Justinian and the Spanish flu in 1918 and smallpox, the numbers are absolutely ghastly. We're talking about 56 million persons affected by the Spanish by smallpox, and so the numbers here that we're seeing are not good. We got about 180,000 deaths in the world, but in the numbers of persons who died by these plagues, the Antonine plague, 5 million, HIV/AIDS, which was not too long, 1980s. It might be long for some people, but I still recall this era where people are absolutely terrified of touching each other, kind of similar to what's happening now. They weren't using masks, but a lot of people are using gloves and so on because they thought that the HIV/AIDS would come from touching people and drinking from the same glasses. And there's a lot of myths and stories that were very negative. People were ostracized during that pandemic. But the numbers were bad, 35 million. And more recently, in 2002, we had the SARS epidemic with 700,000 deaths. So we're seeing, and this is from Johns Hopkins, so we're seeing a number of cases here. We've got a worldwide prevalence rate of about 2 million persons infected. Now, masks and so on that we're using were not unique in terms of those epidemics. As you can see here in the Great Plague, 1665, this man is dressed in this bird-like mask with all kind of herbs and so on in his beak, or it could be a lady, we don't know who's behind the mask, and they did that to protect themselves. And we kind of doing the same thing with all kind of variety of masks now, cloth masks. We get masks look like Darth Vader. So this was a plague outfit, and that was a poem attached to that mask. You see the poem at the side, hats and cloaks of fashion new, made of oilcloth, so that the viruses wouldn't stick on and could be easily cleaned off, captured glasses, veils with antidotes, all lined. So poetry was a way of talking about the plagues, and even the bubonic plague had, you remember that poem, ring a roses, bucket full of posies, tissue, all fall down. Now, that was a poem that actually talks about that plague, where the people would tissue, and then die, all fall down. So the kids would now sing those poems, now realizing they're actually describing a historical event of significant proportions. Here we see the Wuhan market in China barricaded because that was where the sources of infection came from. So we're now talking about the year 2020, where we have a pandemic, and we're looking at so many places being closed down, social distancing, which I personally don't like the term social distances. I prefer using safe distances or physical distancing. But it's just a terminology. We know what it means. We got to keep a distance from each other physically. But we shouldn't be keeping a distance from each other socially. We should have those social connections. Face masks are now common, but face masks carry a danger because persons can have criminal intent behind those face masks. So how are we going to know who they are if everyone is wearing a mask? How are we going to identify people with bad intentions versus good intentions? The other side of this COVID virus pandemic that is very negative is the extreme protective behaviors. I see that with a number of patients who are behaving in an extreme manner. I have patients come into my office with a spray can in their hand, and they start to, without even asking me, start to spray in my furniture and even shooting the spray into the air. And that in itself may not be very healthy, because you can spray your disinfected furniture, but to spray these things into people's nostrils, have them breathe in the disinfectants into lungs, are not necessarily a healthy activity. So we've seen this kind of fear response, and the fear response is somewhat promoted by the media and by the hype. I see now, this morning I just logged into a group chat, I think from the St. Joseph Hospital group site, and somebody was saying that there is a research being done in China where they say that in the air the virus will exist for some time and will start to drop on our heads and so on. So it's just, I'm not saying it's not true, but you know, we gotta be careful with what we hear, because there's so much information coming that we tend to react and become extremely fearful. And what's happening with that fear is translated to our children. So we're going to be very scared about our children in the future. Some countries operate differently from others. So we have a variability. Everybody is using WHO as its gold standard, but in terms of how we respond, there is variation. In Guyana, for example, here we have a partial curfew with lockdown from 6 in the evening, but a fairly free-for-all going on during the day. I just passed a group of pensioners, and they're all clustered together waiting on their pension payments, and that's truly sad to see that you know, the finances are so important for people that they may lose sight of protective measures. The countries like Grenada apparently have a complete lockdown, so there's a fair amount of variability in what we're doing, and we're hearing also from international countries variability. We know that, for example, Sweden, which is has a high mortality rate, has a more open policy, and they may be actually moving towards what we call a herd immunity, or a population immunity of over 60 to 70%, which is more natural. So they're not waiting for a vaccine to come along, but moving towards natural immunity. When we move into natural immunity as open, it doesn't mean that people should be careless and not use protective measures. I personally believe that we really need to build our immunity, our strengthen our bodies, because if we observe people on the streets, the people who tend to be the least protected amongst us, financially and otherwise, most of them seem to be managing physically okay, smoking away and drinking away the persons who we describe as vagrants on the street. So as I said, we have these difference in behaviors. A lot of doctors will use intellectualization and medical discussion to deal with our fears. Some people isolate their feelings, and some people use passive-aggressive behavior and displace aggression onto other people. A lot of negative spin-offs in terms of alcohol use, and we've seen a rise of domestic violence. A report out of, I think, one of our Latin American countries already shows a significant increase in domestic violence because people who would have been out at work are now at home and unfortunately using that time to drink excessively. So there's a lot of panic, a lot of behavior problems, a lot of social problems as a spin-off to this virus, and also a problem with our education. So we have children now who, without receiving direction, will not be disciplined enough, many of them. Some have good innate discipline, but many require that discipline. Thankfully, most schools are operating through online classes, and I want to commend our ministry, I know, and many of our ministries throughout the Caribbean for producing very good online educational programs, and there are many resources for education online. And if you look at the Guyana webpage, modernizing education is one of their goals. And here we have many guides for online programs. I know the Department of Education in Guyana provides national educational programs on radio for different groups, different age groups. So I want to commend them for that. You see nursery programs running from 6 to 9, primary level program from 9 to 12. So the children are able to receive education at home, and hopefully their parents are guiding them to follow these programs. And so there is still continuity, because leaving children alone without guidance, without supervision, as you all know, is not the way to manage our kids. You leave them alone, they will turn to their cell phones or they look at TV all day and not do the work that they should do. So good resources here. It is all taken from our Guyana website, as you see, that was posted on April the 6th. How to manage our children academics. Now, even evaluation examinations can be done online, and there are a number of changes that have been made to the CAPE and the CSEC exams. So again, commend our teachers and the councils that are evaluating our kids. So assessments and evaluations can go on for our children even during this time of having them at home. So can we keep that state of affairs? I don't think people would be able to do that as the workforce gets back out. Children can't be left at home unless somebody stays at home when the parents are both working. So maybe trying to keep an online homeschooling can be possible for some people. Again, it costs. Most private home educational programs, which existed for long before COVID, can provide very good results. There are some advantages and disadvantages to homeschooling. But again, you have problems with supervision. We always say children need to be in school, and it doesn't mean necessarily an external school. It could be a home school, but there are pluses and negatives for school. However, with the future, even though we keep a normal program that we had, or the program that we had before the COVID virus, maybe we'll see some social changes in terms of distancing, ensuring that children with flu-like symptoms don't come to school and spread it around in a congested environment. The use of masks may become a new norm for the future. So looking at the future in terms of what may happen post-COVID, we maybe, as I said, maintain traditional schooling, maybe have some changes. One of our principals, Mrs. Williams, she suggested that children should have a new way of greeting each other. We've seen that the adult population has learned very quickly not to shake hands. So maybe students have to learn to do that. Can we control our students when they're naturally very, emotional in their expressions and would run and greet each other, greet their friends as if they've not seen them for years, and hug and even kiss? And so a lot of behavior changes that we have to start to try to do with our kids, because physical contact, as you know, is one way of this virus spreading. So I believe also if we're in a COVID era, and say hopefully by September we return to a state of normalcy, people are able to come outdoors, go back to work, kids go back to school, there should still be some concerns about safety, because these viruses, not only COVID virus, influenza virus, they are spread a lot by physical contact, by children who have flu symptoms and spread to each other. They don't maintain safe distances. I'm trying to get that type of behavior control applied to children is going to be a challenge. So there will have to be policies how to protect our children, ensure that parents know that if the kid has a fever or a cough, those children should not be at school and should be tested and should be protected. Again, vaccines are the future, and hopefully with vaccines we get a sense of security against this particular virus. But as you know, another viral strain can come along and we can end up with another pandemic. Of course, also we got to look at sporting activities, because this requires many kids to be in close contact, so there would probably have to be policies for how do we protect our children when there is sporting events. There was a lot of fear for sporting events of physical contact during the HIV/AIDS time, and a lot of children who appeared a little different were bullied and treated very, very poorly because of fear. So fear itself has to be looked at as a change in attitude, because some children may be very, very vulnerable to bullying, abuse, being ostracized, or even families can be bullied and ostracized by persons who don't understand what is going on or who may be extremely fearful. So we can maintain our traditional schooling as we had it pre-COVID, go back to school, have our classroom educations, do our assessments in the same manner. Or we may want to use this opportunity to move to some changes. And this is what I want to talk about, because we're looking at, can we apply some methods that can work? We're seeing that the online school that is happening now for most children in their homes is possible. It's not possible, it is happening. Can it be the way of the future? While the children are in a school, a physical school, not in a home school. We could ensure that the safety of our children is predominant and they're able to have a good academic experience in school, but we should also look at their social and physical development, because these are components to academics. My personal feeling, and this personal feeling, is that we spend a lot of time on academics and we don't spend enough time on the social development, the behavioral side of our children, and the sport and other type of activities that they should be encouraged into. It's all seeming about reading, writing, and mathematics and science, and we got to move our children more into other programs, farming programs, technology programs, encourage and reduce negative attitudes to programs like those, because not everybody is cut out to be in science or in law. So let the program be child-centered. That's our goal, that we should be looking at a rounded educational program. We can use more e-platforms in schools. more access to audiovisual material. For example, in the medical school that I was lecturing at, we have the use of what they call the clickers, audiovisual response system, where children can respond instantly in class. It's really wonderful to see that response. You can do actually formative assessments or even structured assessments whilst the class is going on. So you don't have to wait for end of term exam, and that end of term exam is, whilst it's good, also creates a lot of anxiety and stress. So you can actually challenge your children to regular assessments, and you can actually know who is responding correctly by using the tools. And one program we use in our university was turning point system, where every child, every student, every medical student had a honest response clicker and could click on to a question. And the lectures were all heavily weighted with questions. So the questions that we put, rather than giving a dry lecture, we can actually put a question in between and use that for formative assessments. And also maybe have it as part of the summative assessment. Why not? You know, again, it's something that we got to reflect on. Can we do that? Can we change up the way we assess our children, rather than assessing them where we just do one single exam or one major exam? We have them assess more throughout their schooling time, where they may be able to give us a better understanding of how well they're doing. So a couple of points about homeschooling, just as I mentioned that before. The advantages are it's really good for children who have autonomy, who have good self-discipline. They can manage their own time, learn at their own pace. Whereas schooling, in a school setting, they have to follow the flow of the class. Children all tend to be evaluated together. We don't have separate skill levels sometimes. So some schools do that, but most schools have an entire class of varying academic abilities, all trying to grasp the same concepts in the same time. So homeschooling has significant advantages, but also, of course, it has cost to it. So it may be fairly costly for us who may not be able to afford it, you know. So it also has less physical socialization that children really need. They need to be with each other, challenging each other, being able to work through difficulties in relationships, to be able to deal with life difficulties when they leave their academics and become young adults. So less supervision, of course, in a homeschooling. Of course, classroom schooling is more controlled, more easy to apply discipline, and especially if we use audience feedback systems, you can give immediate feedback, but also in classes, teachers often give feedback and can observe how the class is responding and how connected they are with the teacher. The disadvantage of schools, that is out schools not at home, but schools, the big schools that we have, kids can be exposed to problems like viral infection. Bullying is more likely to be in a school setting than a homeschool setting, though cyberbullying is always a concern. And then there's this issue of sexual socialization. We're talking about high school children, so they tend to have hormonal changes that lead into natural feelings, sexual urges. So that's an area that needs to be looked at, because many times they get preoccupied with their emotional feelings and lose sight of learning. There is a new model that I thought of that might be applied, and that is looking at small group learning. And I love small group learning. Not that I would knock down the large classroom learning styles or didactic lectures. I think that small group sessions are beautiful. You can have students who can challenge each other in those small groups. They learn around a concept or a problem. You have the flipped classroom learning, where they actually prepare they prepare the material ahead of the lecturer, so the lecturer would come in now and have a more of a discussion. So there are a number of styles that are fairly modern that we can apply and change our old-fashioned ways if we still have them. I'm not sure if we're still just doing classroom learning. We may be doing more project-based learning or problem-based learning. And the project-based learning, many of our schools also do that, where we learn, we challenge our children around a project where they work in groups and they come up with a project at the end of the assignment. Very beautiful programs, very modernistic in the way, allowing children to interact, challenge for them to see their strengths. There are some difficulties with that, where some children tend to be not so interested, not so motivated, not so committed. So it needs good facilitation. So training for those programs are important. It's not like we can say, okay, teacher, go and start doing problem-based learning along the Dutch or the Canadian models of PBLs and expect teachers to just immediately take it up. All of those people who do it, like myself, had to have special training to become facilitated, but it's not difficult. And you don't have to be a subject expert to be able to facilitate a small group session. So that's something to bear in mind in case you want to ask that kind of question. Yes, any particular teacher from any subject can facilitate a PBL session of small groups. And the group should not be more than about 10 to 12 students. So that's a method that we would use. Start with an essential question, design a plan, create a schedule, monitor, assess, and evaluate. So as you can see, it has an excellent structure to it. There is structure. It is not just something that's vague. Can be done. It can have formative assessments, again, summative assessments, all built into that type of program. What does it do? It helps improve the psychosocial skills, encouraging interaction, so then more active learning by the student. Again, we look at the child-centered learning rather than the teacher-driven learning. We're talking about the child being able to be more active. So rather than passively listen to a classroom lecture, they're able to now interact more. And children love that. Children love to be challenged. They love to discuss. They love to be able to express. One of the things that I heard from the US that's being done in high school is the creation of a circle of trust group meetings where a teacher would facilitate a group. But this is not about education. This is actually about social issues where children are asked to open up. But the circle of trust where confidentiality must be maintained. So the children actually feedback on those groups are excellent because they love to talk about all kind of issues. That's where they can talk about their sexual feelings, about how to manage those, about issues of bullying, and all those issues can be addressed in those groups once the trust is not broken. And trust is confidentiality for adolescents is extremely critical for building their confidence. So group learning has a lot of positive forces. It allows the development of social skills, giving the child the opportunity to express the emotion and change, catharsis that happens, learning, the imparting of information, learning about altruistic ways, supporting each other, helping the child who may not be at the academic level of others to gain confidence, to gain self-belief, and to be supported. So the group itself is a powerful force. I want to also, as I close my session, talk a little bit about emotional intelligence, which is being supported by certain groups, non-governmental groups. Miranda hopefully logged in, who may want to contribute from the foundation. Should you do give another chance foundation, which talks about emotional intelligence, supports that. We had a walk not too long ago where Texila again was involved. Thank you, Texila. You're taking a great lead in the academic activity of our local population. And it's been shown that this emotional intelligence program can help reduce social aggression. We see a lot in our adolescents. A social aggression is now uncommon because of personality, hormonal, behavioral issues. In the United States, they put a program called RULER, which is really the program of emotional intelligence. And as you can see, the RULER, the acronym stands for recognizing, understanding, labeling, expressing, regulating emotions. And I want to emphasize this because, again, many a times we look at these programs as secondary to academic learning, but we got to connect everything together. Social learning, academic learning, behavioral change, personality growth, leadership skills, development of confidence, economic management, learning about other type of skills. If somebody can get into a medical school, what else can they do? Looking at other options of careers and so on, career development, career training. So there are many, many things we are looking at that we can do in terms of holistic development of the child, not just having them produce absolutely brilliant CXC results and then be incapable of managing their lives as adults in society, or go on as bullies and continue to be bullies as leaders and politicians and so on, who are responsible for the development and administration of the countries that we live in. We want people to have empathy and emotional learning, emotional intelligence is a program that helps that. The mood meter is a way for children to monitor their emotions. So the rural schools have been shown to be very effective. Suspensions of children can fall all the way up to about 60%. Bullying decreases. So a number of evaluations have been done. The teachers themselves suffer less burnout and less stress. So there are pluses there. And in the USA, there are bills now being formulated that emotional intelligence should be part of teachers' training. Schools in Australia are utilizing emotional intelligence in Victoria. And in 2005, the UK has put in programs like the SEAL program, which helps in having the children learn social and emotional skills, again emphasizing emotional intelligence and empathy. So I have a few thoughts that I brought to you by talking to some of our teachers. For example, Principal Williams of the North Georgetown School, she suggested that we should have a change to subject teachers and not have form teachers. So not have one teacher assigned to an entire class, but have teachers along the subject lines, making it more accessible to students and creating more of a relationship with the teachers rather than a directive or administrative role. Another teacher that I know came to me for managing her anxiety issues and some stress, talked about having to do too much documentation. She feels she's not enjoying teaching anymore because she's actually getting less time to teach. More social learning skills, as I mentioned before, a lot of teachers feel we should do that. Involving our parents more, not just necessarily on Parent Teachers Day, but having them more involved. We do that through homework, which is really good. But, you know, again, balancing homework, which can sometimes be very excessive, may be the way to go. Also, as a personal note, I feel that children need to be evaluated so we can know their learning style, know how much they can cope with, because for some children, if they're learning at a slower pace and they're put into a class that's accelerated, they're going to be under severe pressure. So they may need to be, they maybe need to have a program that is less fast, at a slower pace. And even in our medical school, we actually had 2 tracks in the curriculum. One for the more faster students. It doesn't mean that the child who may learn more slowly is not as bright as the other child, but it's just the way the child learns. One may take a longer time to reflect on a question versus the other child who's able to pick it up much more quickly. So it's just a learning style that children have. I think we need to move more to that. Dr. Burnett, who is my colleague from University of West Indies and who did her pediatrics there about the same time I did. She brought these to me that some of the challenges we must look out to are problems in socioeconomic disparities where children who may not be able to afford it cannot afford the IT support, the IT equipment at home to assist them, to have those tablets and so on. I heard that the Camille Academy in Guyana is supporting children who sign on to the online program with reduced prices for tablets, and that is wonderful. Tablets, I mean, not my medical tablets, but the internet devices, so that they can learn effectively and access the online program. So a lot of children do also need didactic teaching. We not every child can learn through their own style. What was the last point? Protection of learning. Schools are places of safety, so having them in the school where we can also support some of their nutrition is also very good. So we don't want to necessarily cancel those things. We also need to look at a culture shift, teaching our leaders that can we have a more open mind, can we do more forums, can we have more opportunities for teachers to meet other teachers from the private schools, from the public schools, can we join with international teachers using Zoom based or other seminar programs and be able to share our thoughts and ideas. So how can we do that as a group? So I want to bring that to you, and this is my thoughts. I want to again thank Texila American University in Guyana for affording me that opportunity and inviting me to share with you all. I want now to give you the opportunity for, I don't know how long more we have, Shakti.
Yes, Doctor, thank you for your wonderful presentation. I guess last time we did the same presentation, we got more appreciations from all the guidance counselors.
Very nice.
It was really a fantastic presentation, though. Really, you addressed all the challenges, the situation right now. So we have to think right now how we're going to manage. Mostly, we have to, the transfer the school system pretty much into a online-based system, so that we can also make up our classes and be prepared for the. Preparing the students for the exams and the other related activities. Yeah, so we could wait to see if anybody's having any clarifications at this point of time. If any participants having any clarifications, you could feel free to post it on the chat, and probably we could have Dr. Sharma to address your clarification. And meanwhile, I would like to, register at this point of time. As everybody knows, Texila is a medical school. Yes, we are a medical school, a prominent medical school in the Caribbean, and we also have the other online programs like in the field of business administration, public health, and the behavioral science. So considering the current situation, as you know that the institution cannot function regularly or physically. I mean, all the students are being moved to online, and we have a robust online portal where all the students are invited online, and the faculties come online, and they have the regular classes. Trust me, it is like the regular classes, how the physical classes are happening. I mean, it used to be more of interactive and more of fun while learning. Now all the students are completely equipped, then waiting to get the situation resolved. So we also have a couple of parents who also participated in this webinar, and their students they are studying online with us. They're from Jamaica, and their students is already studying with us. I guess we have some questions, Doctor. From
I think you could tell them also that you all offer online certification for some programs that they could register for. That's free, I believe, right?
Right, Doctor. Thanks for reminding. Yeah, so at this, yeah, so we have about let's say we have about 35 participants for this webinar. So whoever participated today, we can provide them the certification program. It is from the duration from 1 month to 3 months. So we have the certification program in the field of administration, in computer science, in psychology, I mean, in education, and it is more about your upskilling your knowledge. So these certification program, yes, you would be given an access from Texila. Congratulations to everybody. You will be taking a free online program, and those information will be sent to your email, and you could have a look at it. So whichever program you like, you can enroll it. It could be 1 month or 3 months program or 2 month program. Yes, once you complete the program, you will be awarded the certification. It would be an online certification.
Is there a cost to it?
There is no cost attached to it, doctor, for the people who have attended this webinar, and the certification will be sent to their email once they complete the program.
Well, I'm going to sign on, Shakti. And you know, Dr. Burnett, who is actually at St. George's in Grenada as a professor in clinical medicine, she said she read the program and she liked it, and she's definitely going to sign on to it.
Fantastic. So for the people who attended the webinar a couple of days before, I mean, and the people who attended the webinar today, so everybody will be sent the notification via email, preferably early next week, so they can take an advantage of it. I guess there's another person asked, I mean, Ms. Pearson is asking, is there any program fee? There is no program fee for the certification program. However, if you want to enroll to our, the master's or the PhD program, there is a fee attached to it. But for the certification,
but you may want to enroll to the medical program.
Right. Yeah, as well as the medicine program, there's a fee attached to it. I mean,
we got a good medical program. Yeah, I'm quite impressed with it.
Yeah. Right, doctor. I mean, Dr. Dev Sharma is also, a faculty who comes and train our medical student as well. So, as I was saying, there is no fee attached to the certification program. It is absolutely going to be free.
I think we have some questions.
No, doctor. I guess it's been answered. I mean, if there is any other questions, then I mean, you can feel free to. Text us, and I would also leave my email address. I mean, in case anybody want to write back to me, you can write back to me, or if you need this presentation, please feel free to write back to me. I can send this presentation.
I see Jennifer Lawrence is saying thank you. Where are you from, Jennifer?
I'm from Jamaica. Good morning.
I was going to say Jamaica. I just had a feeling.
Right.
We have a lot of Jamaican students at Texila. They're doing very well. Our Jamaicans are making us proud.
Okay.
Jamaica is like home to me.
I'm happy to hear that.
I just miss getting Jamaican citizenship because I left about 4 or 5 months before 5 years. But it's still my home. I love that place. I was going to go and take up a job in beautiful country.
Thank you.
Thank you, doctor. Yeah, so I have left my email address and my WhatsApp. So please do do email to me and WhatsApp to me and with your email address so that I could send that information. I mean, if you email right now on the chat box, I mean, once the session over, I guess all the text and all the chat would get disappeared. So I would kindly appreciate if you could send an email, and we could share whatever information that you want pertaining to the webinar and pertaining to the free certification program.
And you could share my slides too if you like.
Definitely, yes, doctor.
My email, they can connect with you for my email.
Yes, doctor, definitely.
Somebody already sent their email to you. I think.
Right. Yeah. So thanks a lot once again, doctor, and thanks a lot for all the participants who participated. And doctor, you made the session very informative. Once again, thank you. And we would look forward to connect once again with a different topic, which is more of creating more informative for the guidance counselors and the other teachers, in Guyana and the other Caribbean countries.
Wonderful. You take care. Thank you, Shakti, for very good work.
Thanks a lot.